And today I'll be presenting the psychology behind the film A Beautiful Mind, focusing on a depiction of schizophrenia through the character John Nash. So we'll go to the descriptions of the movie. A Beautiful Mind is a biographical drama film about mathematician John Nash. It follows Nash's life from a Princeton student to a professor at MIT, his academic journey, romantic life, onset of illness, and its long-term course. The movie was set in 1947 to 1990s in America. During that time, the psychiatric stigma was really high, and mental illness was often seen as shameful or even dangerous, which strongly influenced Nash's hesitation to seek treatment. Clinical treatment at that time also looked very different, including coma therapy, convulsive therapy, and early antipsychotics. We are now moving on to the diagnosis of John Nash. In the movie, Nash displays symptoms of schizophrenia defined by DSM-5 as abnormalities in one or more in delusion, hallucination, disorganized thinking, grossly disorganized or abnormal motor behavior, and some negative symptoms. In being diagnosed in the 1950s, Nash likely would have been diagnosed with schizophrenia paranoia type because he has persecutory delusion. In the film, he believed that Russian agents are after him. He also had auditory and visual hallucination, which is seeing Parcher giving him orders, the appearance of his college roommate and his niece. Schizophrenia is appears worldwide, but symptoms and outcome vary significantly across cultures. Some cultures interpret hallucination as spiritual messages rather than pathology, and non-Western countries tend to show better long-term outcome for schizophrenia, as research in Linz and Klinsmann in America, schizophrenia is often associated with violence, split personality, and inability to work independently, stereotypes that often worsen the disorder stigma. We will now come to the evidence of John Nash schizophrenia. The first significant evidence of Nash schizophrenia is hallucination, as DSM-5 defines hallucinations are vivid and clear perception-like experiences that occur without an external stimulus, and auditory verbal hallucination are key features. In the movie, Nash repeatedly sees and hears non-existent people. The second significant evidence of Nash schizophrenia is delusions. And as DSM-5 define, delusions are fixed beliefs that are not changed despite conflicting evidence. And in the movie, Nash believes he's being spied, tracked, and recruited. The third one is also a weak symptoms of Nash schizophrenia, which is disorganized thinking. As DSM-5 define disorganized thinking is typically inferred from disorganized speech, including derailment, tangentiality, incoherence, and in a movie, Nash speaks coherently and logically most of the time, except when he gets scared mm, when he gave his speech in front of the crowd because he think he was being spied and was being tracked down by agents. But I think this was because he was scared, not because he has disorganized thinking. If Ness were treated today, he would likely be medicated with antipsychotic medication, which will reduce hallucinations and delusions by blocking dopamine dysregulation. Also, he would be taken to psychosocial therapies (CPTB), um, because it will help Nash learn to question credibility of hallucination. And in French immersion protocol, they show that lead to significant short-term improvement in the symptoms of the disorder. And more importantly, Nash will have to live in a low-stress environment accompanied with social support, because social support is crucial for schizophrenia and can reduce the severity of the symptom. But aside from its benefit, this treatment also comes with some ethical concern. For example, the side effect. So the medication also comes with some side effects such as emotional blunting, weight gain, and motor side effects. Moreover, it would be really hard to get the patient consent because they don't really know they are having the disorder. So it was really hard to get the consent. We may have to get them into the hospital involuntarily, like in Nash case. And there's also a debate about autonomy or safety in the case of schizophrenia patients. There's also some cultural and societal barriers for patients with schizophrenia. In the 1950s, stigma surrounding psychosis discouraged John Nash from seeking treatment, and also high-pressure academic pressures promote his denials of illness. And in that time, community support was really limited, so it can lead to over reliance on involuntary hospitalization. Also, Nash's identity as a mathematician also made medication side effects, which cognitive dulling particularly difficult, which led to his stopping medication. So, on a broader perspective, is the film doing good in accurately portraying schizophrenia? I think it did really good in accurately showing hallucination, delusion, triggers, and long-term effects, but it still needs some improvement with how they show visual hallucination, because most people with the disorder do not have such elaborate visual hallucination. But after this film, maybe it will increase empathy with the disorder and may reduce stigma, influence the patient's willingness to seek treatment. Here are some sources that I use. This is the end of my presentation. This is a really long one, so thank you for listening.